Yeah, Pragmatic Prepper here. I'm just checking in with another video. I did not do one last night. I had a lot of stuff going on. Not much has changed, honestly. Last night was when the lockdown was supposed to start, and let's just jump into it. So last night at 8 o'clock, there was supposed to be a sort of shelter-in-place scenario. Nothing really happened. I saw a bunch of people out, exercising and doing whatever before that, and I'm like, okay, everyone's going to get inside, and once this 8 o'clock rolls around, it's going to look like a ghost town. Got up this morning, and everything was pretty much the same. I went into town and looked around. Parking lots were full. I stopped at the closest Walmart, which is still ways out, and there was probably 100 cars there. Grocery stores, same things. It's like nothing changed. If you look at the actual guidelines or laws, they're not even really laws, but sort of the orders from New York State about like what businesses can remain open and what businesses can remain closed. There's literally so many exemptions that almost everything can stay open. So restaurants are still open for to go and pickup or whatever, and delivery. Dairy Queen was open. A candy shop was open. All the major retailers that sell food were open. All the pharmacies were open. So next to nothing has changed. So I'm not sure we're really doing our best to flatten the curve. I don't know how I feel about the government trying to shut down things to begin with. I don't really think it's the government's business to do that. So there's one of two things going on here, in my estimation. Either it's not that serious, or retailers are trying to squeeze out as much as they can before it gets serious. And I have one great example of that. I stopped into Walmart to see what was available. Ammo was restocked, and some items that previously I had not seen were just suddenly replenished. There was Mountain House, there was, like I said, ammo, there were like holsters, which I had never seen in Walmart before, specific to certain guns available. It was weird. That stuff wasn't there before, and now it's suddenly there. So either Walmart is realizing they're trying to squeeze out the last, few $1 million they can before stuff gets real, or this is all kind of, just a sort of big hoax or not a hoax, or just something that's overblown. I can't tell. So that's up for you guys to decide. Something I did notice that was interesting though is that I don't leave money in the bank. I don't trust banks. I don't trust numbers on a screen. I take my cash out as soon as it's available. So when I went to the bank, it was closed earlier than usual, and the ATM was out of cash. So I said, okay. So I went to another one, also closed early, and the ATM was gone, literally removed from the wall. It just wasn't there. I was like, okay. So I went to a third branch, closed early, but the ATM was there, and I was able to get my cash out. So that can, be a lot of different things. I mean, obviously there's a bigger demand for cash now, people taking stuff out like I would. And banks don't have as much money on hand as people would think that they do. They just don't. They're sort of like a healthcare system. They're designed around fluctuations, same with any other system like groceries or gas or anything like that. And when there's a spike, they don't have the supplies there of cash to give you what you want if everyone was to hit, in the same place. In any event, some people might look at that and say, okay, well, maybe they're just giving out all the cash that they have because the end goal here is to go to eventually to a cashless society. Maybe the Fed is holding on to cash. Maybe they're getting rid of it. Maybe they're collecting it. Who knows? It could go so many different ways. You guys can take from that what you want. Take a look at my notes here. I'm So yeah, I mean, like I said, there's a lot more people out than I thought would be. Probably more people out than there should be. I don't think this is really doing anything. Um, and then, I mean, you see major retailers, just even on TV. Car companies are still selling cars. They're extending credit to people. Um, they're offering deferred payments. You're still going to pay that money if you buy a car now. I wouldn't recommend anyone buy a new car now, but you're going to have to pay that eventually. So big business is still doing business as usual. I'm going to have a sip of my my favorite beer. Well, my favorite affordable beer. This is Edmund Fitzgerald Porter out of Great Lakes Brewing in Cleveland. It's a sort of a coffee flavored porter. I love this. It's still available, so I can enjoy that part. As far as sort of the national news goes, and even regional, the number of cases are up, but that's because more kits are available and more people are being tested. The overall death rate is very, very low, and it's actually starting to drop when you take in the complete numbers of cases reported and the fatality totals. And this isn't even including people that aren't showing symptoms. I mean, there's tons of people out there that probably have this COVID. I could have it for all I know, and they're not showing any symptoms. But there's also the other side of the coin where there's people who maybe are dying from other things or from this and that haven't been tested. So that's something to consider. We're also not at the point where we're at a critical threshold like other countries, China, Italy, such as that, where people are just, dealing with other conditions that just aren't being treated. We're not there yet. Governor Cuomo predicted that somewhere between 40 and 80% of New York residents in the state could be infected with COVID-19. I mean, I don't know where he gets that number from. It's possible. Who knows? That's like saying somewhere between 40 and 80% of people in New York could get the cold. I mean, so what? So my main question now is, did we get played? Or is this overblown or is this underblown? There's so many different factors at play there between government and private industry and capitalism and everything else that goes on that you really have no idea what the actual stuff is. It's like the fog of war. You can't really tell what's going on from where you're sitting. Other things, they're working on a vaccine, allegedly. They say it might be a year out. I don't know. Could be shorter than that, could be longer than that. Some people are saying this thing might exist or might last, a couple months. Some people are saying up to 9 months. Some people say it might die down and then come back in the fall. But that's kind of like any other, infectious disease, like the flu or the cold or any of that other stuff that goes around. There have been some clinical trials on stuff about, hydrochloroquine, which is a anti-malarial quinine-based drug. They've had studies about that by itself. Also, that information is mostly coming out of France. There's been some U.S. cases of doctors using that for patients who are unresponsive to other treatments, and it's, apparently worked for bad cases. I've seen studies about that drug in combination with azithromycin and how that has, some very, very strong effects. I don't know. People that say that it doesn't have side effects, though, they don't know what they're talking about. Those drugs have very, very serious side effects, which is why they're only using it as a last resort, and why doctors are kind of hesitant to just give it to everybody. It's not like, you're taking Sudafed. It's serious stuff, which is, if you had malaria, you would take it and deal with the side effects. But anyone that knows anything about malarial drugs, anti-malarial drugs, will know that quinines have very, very serious side effects, which is why they're not giving it to everybody, and they shouldn't. It's readily available and it's relatively inexpensive, but it's there's a lot of downsides to it. That being said, I think we're all sort of ready and expecting this impending doom coming down. There's no military lockdown. There's no troops in the streets. I haven't seen anything even disrupting traffic. The National Guard has been called into several states, including New York. Illinois, California are the main three. Probably Washington. But supposedly those are only to bolster support for, the medical community. I don't know what that really means. What that could mean. One interesting thing, though, the Department of Justice did sort of quietly and surreptitiously ask Congress for more powers, sort of kind of like wartime powers, where they would sort of suspend habeas corpus, which would be your right to a hearing, or you couldn't be held indefinitely. That's a little bit disconcerting, to say the least. But the DOJ responded and said, we were only doing that to make things quicker and we could expedite things, and those decisions would be left up to judges. I don't really want my right to be formally charged within a certain amount of time suspended and left up to a judge, because if I had to guess, I would say that the judge is more likely to side with requests from the DOJ or with requests from higher ups to just say, okay, we'll leave this person in there and we'll figure it out later. I don't like that idea. That's anti-American. It's anti-constitutional. I don't agree with that, and I don't completely trust the DOJ's response to the backlash. I just don't. Sorry, not sorry. So there's that to think about. I understand it in terms of when you're looking at sort of a catastrophe or a wartime scenario, but when it comes to something like this, when you're not fighting a foreign or domestic enemy, you're talking about a virus, that doesn't fly with me. But nothing I can do about it. Not much else for me to add. I hope that you guys are all thoroughly aware of what's going on. The trucks are still moving, so if you need to get more supplies, get them. Go out there and get them. Also, while weighing the risk of interacting with the community and dealing with potentially being infected by this virus. I know for myself, I'm just gonna avoid big groups as much as I can. I don't really need to be involved with them right now. I can sit that out for quite a while if I want to. But still get your exercise in, get your social interaction in with the people around you, responsibly. Text family and friends, call family and friends, Skype family and friends, and do that kind of stuff so you don't feel isolated. And we'll see where this goes. I was expecting a much more drastic sort of situation, and I haven't seen that yet. That could change. That could change in a matter of minutes or days or whatever. So just wanted to get this out. I will be updating you guys soon if anything changes drastically. Otherwise, I'll just keep posting these videos and stick to the topic and give you any relevant information that I have. And as always, take care of yourselves and each other. Love y'all, and Pragmatic Prepper out.